All right. Well, thank you to those of you who logged in for this afternoon's program. My name is Sean Santana. I'm a part of the communications team here at Carbon Health. Today's program is how to create your wellness program, and we're going to go ahead and get started. So before we get into the meat of today, I believe we have a couple housekeeping items. So we'll go ahead and run through those, and then we'll meet our panelists. So first off, this webinar is being recorded, so you'll receive an email with a recording after the webinar. All attendees are in listen-only mode, so you may ask questions in the Zoom questions panel. If you'll notice at the bottom of your screen, there is that normal chat box, but you want to do is look at the Q&A button. So that's how you'll be able to submit questions, and there is an option there to submit them anonymously, so feel free to take advantage of that feature there. And then again, on the topic of questions, please feel empowered to ask those questions. So this session was created specifically for you. And if you have a question, there are probably others who have the same question. So please be sure to take advantage of that option there. So again, that's the Q&A button down at the bottom of the screen. Okay, let's go ahead and meet our panelists. So I'll have them introduce themselves, but starting on the left there, you see our Medical Director of Enterprise and Strategic Partnerships, Dr. Aaliya Yaqub.
Hi, everyone. It's nice to be here. I'll just introduce myself briefly. I'm Dr. Aaliya Yaqub. I am a board certified internist, still practicing, and I'm the medical director on the enterprise side here at Carbon Health. My passions include specifically wellness and helping people get back on track after COVID. And I'm excited to have a great conversation with Dr. Noel Battle.
Hi, I'm Dr. Noel Battle. I'm a family medicine physician. I'm the medical director for primary care at Carbon, practicing for about 21 years in primary care. And I have a similar passion for wellness and preventative services. And I'm excited to jump into the conversation as well.
Excellent. Thank you so much for joining us today, Dr. Yaqub and Dr. Battle. I'm going to go ahead and step aside and let Dr. Battle tell you a little bit more about Carbon Health.
I'm going to pass the mic to Dr. Yaqub. I think she's...
Okay, so Carbon Health, as many of you are familiar with, is a technology-enabled healthcare provider. We use smart technology and modern clinics, and we specialize in urgent care, primary care, and mental health. We also take an omni-channel approach, which means that you can access us virtually, in clinic, basically any way that is most convenient for you. Our mission is to make high-quality healthcare accessible to everyone. We are really interested in creating a culture of health and wellness. And so, as I mentioned, we have virtual and in-person primary and urgent care. We also do full spectrum women's health and LGBTQ plus health. We offer same-day appointments. We create personalized healthcare plans. We also are interested in creating helpful content. So we have a great wellness blog with health news and tips and time-sensitive relevant things related to COVID as well. And at Carbon, we're very much interested in offering inclusive, judgment-free care. So wherever you are, whatever your preferences are, we're a place where you won't be judged and you'll feel included. We also take care of employees at companies. And as part of our services there, we do offer mental health assessments and counseling and therapy. We also do biometric screening, physical exam screening, and consultation on site at the employer's office or in our clinics. We have the capability to do on-site rapid labs and biometrics with same-day results, which is a very popular option. And then we really take it a step further and do care coordination and hand-holding and navigation for those that need a little bit more of a sort of a high-touch service. We also, do referrals for risk-based screening. We're talking about things like cancer screening to help prevent chronic medical conditions. And then all of our results are immediately shared in the app for individual patients. So it's a really great patient experience. The employer, however, sees a dashboard that highlights risk areas that they need to look at and may be concerned about. And so they get population level metrics and data that are really, really helpful for them in terms of planning and understanding what their population is going through and what their population may look like. And then if you do an event with us on site at your workplace, we also have post-event employer consultation with our medical directors. So anytime there is any question, recently it's been mostly related to COVID, but if there needs to be consultation with our medical directors, we do offer that for HR professionals. All right, so I guess let's head into our Q&A.
Yeah, we've prepared some questions ahead of time, but again, if you do have any questions that aren't answered or that you're inspired to ask, please do that. Use that Q&A button, which is at the bottom. You can submit those questions anonymously. So we're going to go ahead and jump into the questions. This first question is actually going to be for Noel, who fittingly is our National Director for Primary Care. So Noel, I think what's really important that some people don't realize is we hear the word primary care thrown around a lot, but people don't always know exactly what that means. So would you tell us a little bit about what is primary care?
I'd love to. Thank you. So a primary care clinician kind of falls into a few different buckets. One of them is a family medicine physician like myself, internal medicine like Aaliya, and we also have a specialty called internal medicine and pediatrics. Gynecologists actually do primary care for their patients, and pediatrics also do primary care for their patients. Primary care providers provide longitudinal care for chronic conditions, but also for for acute conditions as well too. They're your health coaches along your journey of life. So from babies to geriatrics, they're your quarterback and health coaches.
Yeah, and I always like to say that for folks who don't understand primary care or the importance of having someone in primary care in your life, it's like somebody who is well acquainted with your life, with your health, and you can walk in for your visit and your primary care doctor will say, oh gosh, Stephanie, you look really down today. What's going on? They'll notice the nuances sort of in your life and any changes, and can sort of help anticipate and do appropriate diagnostic testing and catch things earlier than if you were not to have that sort of relationship.
Exactly. And a lot of those instances, they're taking care of generational people in your family as well too. So they know a lot more than just surface level. They actually can speak to things or understand things related to what's going on in your personal life or family life, just because, again, they've had those conversations and relationships with you.
So that actually makes me wonder, the two of you are talking about longitudinal care, providing, building a bond, and providing long-term care for an individual. It's one thing to bring the appropriate clinical set of skills, but how do you as physicians form a bond? How do you earn the trust of your patient and get to a place where you're going to go on this journey together?
Yeah, I used to teach residents. It's very humbling when someone walks in your office for the very first time and they're sharing personal information with you that they may not share with their family, friends, or loved ones, and you're taking that in. And so that understanding that's a very vulnerable position that our patients are in, and humbling for us to be in the position to kind of take that in. So it's really about building that trust and understanding that we're going to take that cherished information you gave us and use it to kind of help you along your journey. So listening, meeting people, kind of where Dr. Yaqub mentioned earlier, meeting people where they are, being non-judgmental, understanding it's a vulnerable space and we want to respect that space, I think is very important. And then showing obviously clinical and technical proficiency to give them at ease that not only can you share that information with us, but we're also going to basically take that information and use it in a way that's going to help you along that journey.
And all of our clinicians at Carbon Health are basically trained with the same principles. We have the same mission, which is to offer the highest quality care that we can and to really be good listeners. So when we're in the room with our patients, we're there really listening to what's going on, paying attention to cues. Sometimes people may not tell you what's really going on because they don't feel comfortable, but we have to sort of read between the lines and ask, more questions and make people feel comfortable. I think that's really what our job is to increase their level of comfort so that they can open up and really share what they need to share so they can make their lives better.
Great points. I know, I'm sure we've all found ourselves in the patient seat at one point or another, and it can be really difficult to open up if you don't feel that trust with your physician. So I'm glad that we place so much emphasis on earning that. All right. So speaking of maintenance, there are checkpoints along someone's health journey, and that can come in the form of an annual physical. So why should employees go in for an annual physical?
I could take that one. So an annual physical feels kind of like something you have to do, and you just sort of schedule it, and people kind of dread it. And they're like, okay, I have to take an hour off of work, maybe 2 hours, including sort of commuting and parking and all of that. But really what the annual physical is your opportunity to kind of look under the hood, discuss anything that's bothering you in your life. And, physicians are really trained to put the pieces together, put the puzzle together for you. So you might be having some sleep issues and some digestive issues and something that maybe, you're just sort of noticing is bothering you. And your doctor can say, hey, gosh, like all of those things put together make me think that we should test for X or Y or Z and make sure that there's nothing worse going on. And so that annual physical is not just sort of something that you have to do, but is typically very valuable because we do a full set of labs on you to make sure that things like your cholesterol, your blood counts, your electrolytes, kidney function, liver function, all of that looks good. And then, there's always the mental health screen, which right now is very pertinent because people are struggling across the board, not just with the pandemic and pandemic fatigue, but also with just general life pressures, which, and what's happening in the world. There's a lot happening, and I think people are struggling for a variety of reasons. And so I think more important than ever, it's now more important than ever to actually go in, get your annual physical done, make sure that your body is in a good state, but also sort of your mental health and kind of check in with your doctor.
Yeah, I completely agree with that. And there's enough evidence out there. So we know at certain ages and stages in our life, there are things that we should just naturally check. But then it also gives, that's kind of what drives some of the labs and some of the questions that we ask specifically around mental health and behavioral health. But also too, this gives a patient or persons an opportunity to kind of expound on some of the things that they may have questions on in those health checks. And so you don't have to feel as though you're coming in with an agenda, although we do have some things that we want to check during that time frame. But it gives the patients a chance to kind of expound on things that they may have questions about, and then we can kind of do further dig deeper and define kind of other things or health needs that are necessary for that person.
Dr. Battle, do you want to actually go through some of those checkpoints that are age related, maybe for both?
For females, we know typically around age 21, we start doing more gynecological or pap smears exams for, which is obviously important. In our 40s and 50s, we start doing more screenings for cancer, specifically breast cancer screening, colon cancer screenings, looking at screenings for men's health for prostate screenings as well too. So those are for heart health. We're doing heart health screenings, which include cholesterol and blood sugar screenings throughout, where we check your labs for cholesterol and blood sugars. We all know the pediatric screenings, but that's not more appropriate during this time frame. But those are some of the things that we do specifically at certain ages. And typically for an exam, you can go in every year for an annual exam, starting as an adult, and that may drive us to say we need to see you more often or less often. Again, there's evidence behind each one of those screenings about when they should take place and how often they should take place. But the key thing is getting a baseline evaluation to kind of understand where those checkpoints are.
Yeah, I would also say that the annual physical really touches upon some of the things that we don't think about that are super obvious as well, such as sleep. How's your sleep? We talked a little bit about mental health. We kind of touched a little bit on nutrition when it comes to diabetes prevention, but nutrition, weight loss, if that's sort of, an issue, and really just, your quality of life as well is very important to your clinicians, and making sure that there isn't something that's truly troubling you that isn't going to get addressed.
Yeah. Yeah, unfortunately, as we all know, with the pandemic, life was shut down for a long for all of us, but those disease processes and those biological things are happening. They did not stop, and we see a lot more depression, anxiety, insomnia, a use or abuse of alcohol. So all those things have kind of been accumulating over time. And now this is, now that we have more opportunity to seek help from our primary care providers, this is a great opportunity to kind of dive in to kind of address some of those issues that obviously we couldn't address as thoroughly over the last year and a half.
Thank you both, and thank you for touching on mental health, because a lot of people forget about that part of themselves. The whole person is relevant when it comes to taking care of someone, and that's a big component. Speaking of the pandemic, a lot of us are just getting comfortable with leaving the house, whether it's picking up lunch or maybe being a little less stressed, just doing some grocery shopping. And as Noel mentioned, sometimes going to the doctor wasn't the highest priority, maybe if you didn't have something that you thought was urgent. But now that things feel more safe, is it safe to go to a doctor?
I believe so. Aaliya, I'm not sure if you want to kind of touch on this at all. I touch on this at all. I know we have the same.
Yeah. I always tell friends and family who ask this very question that it's probably safer to go see your doctor than it is to do some of the other things that you're probably doing while you're out and about. At your clinic and at your doctor's office, they are sanitizing very often. They're abiding by very strict protocols. Everyone is masked appropriately and wearing the appropriate personal protective equipment. And so I think people should feel reassured going to their doctor and continuing with their preventive care and wellness visits, because that's so important. We want to make sure to catch things that are developing early rather than later, when they're harder to treat and when they're more severe and when they're more costly and when they may not be reversible. Earlier on in the course of disease, we can sometimes reverse or cure things, but as they become more severe, it becomes harder and harder. Also, we've noticed that during the pandemic, people have developed some unhealthy coping mechanisms for stress and for mental health issues. And so, as Dr. Battle touched a little bit on there, we're seeing a lot of substance abuse and self-medication using sleep aids and illicit drugs. And people are trying all sorts of things to sort of keep themselves afloat mentally and emotionally during this tough time. And so, those are things that we are happy to help with and happy to address in clinic and, have wonderful solutions to help, with those challenges that people are going through.
Now, in my personal journey, I know I'm talking about a lot about myself today. I often didn't see a provider unless I had an urgent need. And I've had a couple conversations that when I popped into those urgent cares where a provider said, do you have a primary care provider? And I said, no. And they said, you got to get on that. You need to find a primary care provider. And I'm sure they have a very good point there, but it just never occurred to me. So then the question is, why? Why is it so important to find a primary care provider?
Yeah, we do have a lot of we are noticing a lot of acute needs, but with our health journey is a continuum. So typically, if we're able to get into primary care providers, we can sometimes head off some of these things that may be what we consider to be acute or kind of coming out of the blue. We can sometimes head those off if we have that good relationship, which is what we touched on before. So we have a good working personal relationship with someone who actually knows us, knows what's going on with us. And then we can sometimes elicit questions that may give us an insight of kind of things that may come up. And interesting enough, primary care clinicians actually do quite a bit of urgent care or acute care as well too. So now instead of having to go to someone who you may not necessarily know or feel comfortable as much with, you actually now sometimes take those needs to your primary care clinician and they can manage them just as well. I think one of the great parts about Carbon is we actually have a team-based program or team-based care that systems try to create in their clinics, but we have naturally and organically done it. We have primary care and urgent care clinicians working side by side in the same location. So going to see your primary care clinician on days where they're not there, you may see an urgent care provider, and there's actually a collaboration or handoff that actually is taking place organically, but also too purposefully, where you feel as though you're actually getting care under the same home and from the same team. And so establishing with that primary care person, though, you always have that base for healthcare where you can always seek advice and get it consistently from someone who knows you pretty well.
I sort of see your primary care provider as someone who takes ownership, right? They're responsible. They're your advocate. They are keeping track of things over the long term. So whereas if you're just utilizing an urgent care, you're going in, you're getting your particular issue taken care of, and then that's it. But your primary care provider is really trying to keep track of everything and making sure that they're advocating for you in your health journey. They're sort of looking at you holistically as a whole person and trying to figure out what parts may need, some more investigation and, really looking at every system in your body. That's really the job.
Oh, you have nailed it. I was in private practice for a period of time, and I would tell my patients all the time, the buck stops with me. And I felt comfortable doing that because I understood how important it was for them to feel as though they can bring their children, their parents, whomever, or themselves to see me and know that I'm going to take responsibility. So that's a great point. I think it's poignant for primary care.
Yeah, and I tell young people who are in their 20s and 30s that if you don't have a primary care provider, you really don't have a true advocate in a health sense. That's your advocate in the healthcare system and with regard to looking around corners and figuring out what to expect next with your health.
That is such a huge part of the experience. As someone, again, who hasn't had as much experience in the primary care world, just as a patient, it can be very intimidating. And sometimes you feel like you're out there alone. So whether it's because you're relatively young, or maybe you just got your first full-time job and you have healthcare benefits for the first time. And of course, there's just acronyms and all these other words that are really intimidating. So to go out there and to go it alone is really, can be really scary sometimes. So to be able to find that person who can really go on this journey with you together, that's so meaningful, which takes us to our next question. We understand the importance of having a primary care provider, of having that relationship and what they can offer us. But how do you actually find that person? How do you find a primary care provider?
Yeah, I'm pretty sure you have a great answer for this.
Oh, okay. I'll take a stab at it. So I think within the Carbon network, we have really great options for primary care providers in terms of gender, in terms of clinical interest, and in terms of training level of experience. We just have a very diverse workforce. And so I think it's easy within our system to find somebody that you feel like you can connect with and who you feel compatible with. And there is a level of compatibility that's needed because you're opening up about some really personal parts of your health. And we want you to feel comfortable doing that. So we have a great sort of roster, a team, I would say, in each of our clinics that you can access from, and also amongst our virtual care providers as well.
I absolutely. And our app is obviously extremely user friendly, and we have quite a few locations. So proximity is usually not an issue. Information about the different providers is provided in our app as well too. So kind of trying to weed through and see what best fits for you is I think is very doable in our app and our platform.
Thank you both. Noel, you actually touched on this already, but I wanted to go back to it. So it may feel like the world stopped in 2020. A lot of, gyms and restaurants and concerts, all of that kind of fell away. But as Noel pointed out, your body, kept going, your health continued to progress, and it had to endure all of those, crazy parts of 2020 that we didn't expect. And the world continued to take its toll. So what are we seeing? What are we seeing the problems that have developed over the pandemic that people have experienced and are now kind of manifesting or becoming more obvious?
Yeah, the most troubling one is our issues related to behavioral health. And it's not as though behavioral health or depression, more specifically depression or anxiety or insomnia, it's not as though those issues had not been present before, but being isolated for such a long period of time, kind of losing a sense of kind of community for that time frame has highlighted how important our mental health and how it's actually tied into our physical health. So lack of sleep, anxiety, depression has increased our use of various substances, including alcohol, which unfortunately contributes to more depression or anxiety. We've had fluctuations in weight, so that contributes to or related to our heart health and potentially pre-diabetes. Our lack of sleep, unfortunately, has also contributed to our less productivity in our jobs or our work. So everything's a cascading effect. So we've seen much more depression, anxiety, insomnia, heart disease and heart-related conditions. Again, weight gain and obesity. Those have kind of been highlighted over the last year and a half as previously as issues that we all knew about. Now as just as big a pandemic as COVID.
Got it. Okay, so we do have a couple more questions here, but I want to remind everybody listening that we do have the Q&A feature there. So if you've got any questions that we're not covering, or maybe you wanted us to circle back and dig into a little bit more, you do have the option to submit questions anonymously. So please don't be afraid to submit your questions there using that Q&A feature. Okay, so we've talked about what primary care providers can do for patients, and I'm sure there's a lot that people don't even realize, because again, we sometimes don't have the full picture of what makes up our health. So is there anything that people might be struggling with that they don't even realize can be addressed in primary care?
Yeah, I think one important point is women's health is very addressable in primary care. So when it comes to your annual exam, your pap smear, breast exam, all of that can be done with your primary care provider. You don't have to go and find a separate OBGYN to do that. Same thing is like for your mammogram or for osteoporosis screening for women who are in their 50s and above, or if you have a family history of that. Those are things that your primary care provider can definitely handle. And your primary care provider is also sort of like your guide through the healthcare system in a way, because we can point you to the right specialist if you need it. We can point you to the right testing. We can have a discussion with the specialist on your behalf and save you a visit, if possible. So there's a lot of things that we can do in primary care that I think people aren't aware of. There are a lot of ways we can advocate for you.
All right. Aaliya, I think you mentioned this earlier, but let's go ahead and go back to it just a bit. Sometimes part of one of the benefits of those annual physicals, those check-ins, are catching things early, and that can make a big difference, right? So could you talk a little bit more about how does regular preventative care help us avoid more severe disease? What are the benefits of catching a condition early?
Yeah, I think there are so many examples of that. Maybe I'll just take one that I think we see very commonly, which is cancer. If you have a primary care provider that you've been seeing, let's say on and off for a while, and you brought up a concern, you said, "Hey, I noticed this lump under my arm, and it's kind of been there." Your doctor kind of knows about it, and you come back in, and there's somebody who's sort of like looking at it, and you're under surveillance, right? Like your primary care provider is aware that you have this lump. If it turns out that that lump is affiliated with a cancer, or is, it's better that, we notice that earlier rather than later, versus a lot of times people don't have a primary care provider, or they'll see somebody in urgent care and they'll be like, "Oh, I have this lump under my arm." And the urgent care provider's like, "Cool, it looks good, it's fine. Why don't you follow up with your primary care provider?" uh, you know, that relationship and the way that you see your primary care provider, let's say, even if it's once a year, allows you this like checkpoint and time to really take a look at everything from head to toe in every system of your body, and allows you the time and space to do that. And so what we often see is that we catch things much earlier than folks who didn't have a primary care provider, or those who weren't seeing a doctor somewhere. And, in real world terms, that's the difference between like a stage 1 and a stage 4 cancer sometimes, or, that's the difference between pre-diabetes and full-blown diabetes that requires a lot of intervention and, starts affecting your quality of life in a tremendous way. Obviously with things like depression and anxiety, you can, if you leave those things sort of untreated and unmanaged, we know what the, unfortunate consequences of that can be. So there are definitely, I think, what we see is catching things earlier on and being able to manage them before they get too severe as a huge, huge, huge benefit to having regular and continuous contact with your primary care provider, your PCP. And that doesn't necessarily mean like coming in all the time. It's like if you have your PCP, you can also text or you can send a message and just say, hey, like this thing happened, what should I do about it? And your PCP can sort of weigh in on that and provide you guidance or say, hey, come in, let's take a look at it. Let's see what to do about it.
Actually, I completely agree. I think most times as a primary care provider, we prefer to be at the earliest stages so we can kind of give you that advice. I think, historically patients feel as though as soon as they come to see us, we're going to do some tests, find things, and all of a sudden put patients on medications from the beginning. The goal is that we catch it at that pre stage, and we do that through asking questions related to their personal health, their physical health, family history, where they live, because zip code matters as well too. All those things kind of help us paint a picture of who that person is. And so now we're able to kind of figure out screening tests or screening information or screening things we need to do to kind of figure out your baseline level of health at the earliest stages. And then we can kind of give you more directive care. It's not just draw a line in the sand that says everyone this age with these numbers gets this type of treatment. We can actually make it more personalized based off of that information. And the earlier we get that information, the more we can personalize it and maybe prevent late stage disease from happening or curtail it from being so bad.
Yeah, and also we can reduce ER visits, for things that, commonly lead people to the ER. Sometimes your PCP can help you manage those conditions or avoid those conditions that will lead you to end up in the ER.
And it's got multiple benefits as a patient, right? You're talking about cost saving, but also, maybe our most precious commodity, which is time. How many hours in the ER versus just little check-ins along the way with your primary care provider. And I think those are all more benefits, again, to that partnership that you form with your PCP, knowing that they are your advocate, knowing that they're with you all along the way and they're catching things and they're thinking ahead. Sorry, just a question just came in, so it caught my eye. I apologize. So this question says, it sounds like Carbon Health primary care may have some benefits over a typical primary care clinic. Technologies and other ways to communicate with patients are a big part of it. So how does Carbon stand out in the field?
I think Carbon offers more services than the average primary care office. We have urgent care, so we can do x-rays, we can do some splinting if there's, a fracture in some cases. We have rapid lab capabilities. Our technology also allows us to interface with people when they need it, rather than having to stay on the phone or having to come in. Sometimes we can sort of answer questions and direct people and help them navigate the system just through our app, which is, I think, a huge convenience. And, when things are inconvenient, people kind of don't want to engage with it. So what I've seen in other places is if it's inconvenient to get in touch with your doctor, then you don't get in touch with your doctor and things sort of get worse, or you end up, in the ER or something. So being able to contact your care team at any time, I think, is super helpful. And then having as many services as possible under one roof is also, I think, a big plus.
Great.
I think that's a huge component as well with the chaos of life, especially some people are still navigating returning to work, and maybe they're at home part of the time, maybe they're homeschooling their children. It's not as easy to get out the door, so that's just one more barrier. But if I can get in touch with my provider through an app that's already on my phone, not some website I have to go log into and remember my password to, it's already here in my hand, and have a conversation with a real person, it just makes it so much easier. And I think that's a huge benefit of what we offer. Okay, so I think we've made it to the end of our questions this afternoon. Before we say goodbye, Dr. Battle, Dr. Yaqub, is there anything else you wanted to share?
No, I think we've touched on most of these topics before, but I think the highlighting that we are in a position where seeking healthcare at this stage is extremely safe. And we have some very skilled clinicians throughout Carbon, both on the urgent care side and the primary care side, to kind of meet everyone's healthcare needs. But not only the needs that you know about, but also to the needs that we would discover from kind of coming in, having a conversation, and determining kind of what you may need, and what you may know and what you may not know. So I welcome those opportunities to come and join or meet our primary care team.
Yeah, and virtual care too. If it's hard to come in, we can take care of you virtually. If you're, between locations, traveling, whatnot, we're always there sort of by your side. You can access us virtually. And I think, that's something that's really helpful, especially in the world that we live in right now, where convenience matters a tremendous amount.
All right, looks like I may have spoken too soon. One more question just came in. Let's see what we've got here. So it says, given the varying mandates across the country surrounding vaccination and return to work, what are your philosophies on testing and establishing preventive care for employees?
So when it comes to testing employees in the workplace, we have really great set protocols that are based on guidance from the CDC, what's happening across the US and other health organizations. And so we've developed those protocols and that guidance, and we work directly with employers in deploying that guidance and advice, and we sort of handhold through that process. And we have a great team that helps us do COVID testing. We obviously have a whole effort to vaccinate folks and provide some education around vaccines to get people comfortable with them in case there's vaccine hesitancy. And maybe Noel, I'll let you talk about the preventative aspect of it.
With regards to the preventive from COVID, I'm sorry about that.
Yeah. No, the question I think was, what are our philosophies on establishing preventive care for employees? So how does preventive care differ for employees, for enterprise?
Yeah, so our preventative services, we're thinking about doing specific screenings for diabetes, obesity, weight, heart disease. We want to make sure we're kind of we want to make sure we catch all these things as early as we possibly can in the process. And so bringing people in, having a set screening test, so we're actually able to screen for those particular processes are important in the process.
Yeah, I should also mention that we have a really great diabetes program that's in the final stages of almost launching. And so that's going to be a great asset, I think, for employers as well, who are looking to prevent diabetes, help folks manage diabetes, and identify those who have prediabetes and help them prevent it from progressing to actual full-blown diabetes. And we're using really cool devices called continuous glucose monitors, and sort of the most modern technology to help us change people's behavior and help them avoid bad consequences of chronic disease. We're also sort of working on that sort of thing in terms of hypertension, high blood pressure, which is also a silent killer that's involved in development of cardiac disease and stroke. And so we're investing a lot in helping prevent and treat and track chronic diseases that people, are experiencing. And, in terms of for the employers, we are developing dashboards so we can give you population level metrics and data so you can help manage your population and understand what sort of needs are within your population as well.
All great tools and great resources. Okay, so that is our final question. Again, I want to thank Dr. Battle and Dr. Yaqub for joining us and sharing your stories and your perspectives. And for everyone who listened in today, thank you again for your time.